It has come to my attention that I have overlooked a subject in my series of videos of the things that we need to work on in Washington, and that is the healthcare problem. Repealing, replacing Obamacare, and stuff like that. I think I have touched on it once or twice in previous videos, but I have not sit down and made an actual healthcare video like I've been intending on doing. So let's talk about healthcare. First and foremost, what do I stand for on that? We need to get rid of Obamacare. It is nothing but an albatross around the neck of the economy of this country. It is not doing the things it was promised, okay? The healthcare system in this country is broke. We all know that. Healthcare costs are ridiculous. There's a couple reasons for healthcare cost. And a big one is, well, technology. The more technology gets involved, and technology is not cheap, it's expensive, then the more that cost of healthcare goes up. Additionally, the hospitals are not run the same as they used to be 40, 50 years ago. When I was a kid, hospital staff were hospital staff. The doctors had their own practice, but they were on the staff of the hospital. Additionally, everybody else that worked for that hospital, or everybody that you seen when you were in that hospital, was a member of that hospital staff. What that means is the radiologist, if you went and had to have an x-ray, the radiologist worked for the hospital. If you had an infection and you had to have an infection specialist or someone dealing strictly with infections, they were on staff. If you had surgery, the anesthesiologist was a part of the hospital staff. Nowadays, all of these things are contracted by the hospital. You have all of these separate businesses that contract with hospitals to do it. The ambulance, the ambulance that came and got you when you called for an emergency, was owned by the hospital. Okay, at least here where I'm from. And so nowadays, when an ambulance comes and picks you up, you get a bill from the ambulance. If you go to surgery, you get a bill from the doctor, you get a bill from the anesthesiologist, you get bills from 10 different people. Used to be you got one bill from a hospital, and it was for what was done. And healthcare was a little more considered affordable at that time. All right. Now, another reason, like I said, is with technology, the cost of stuff. That's really hard to deal with in any way, shape, or form, because a CAT scan machine is going to cost what a CAT machine is going to cost. So now health insurance, and that's what Obamacare dealt with directly, was health insurance. Now the problem with Obamacare is it mandates what insurance companies have to cover. That was a main reason why premiums went up so high. My biggest issue with all of that is the HMO plans. Before HMOs, healthcare was a lot less complicated and a lot less expensive. Once the HMOs got involved, prices started going up. So I do not agree with HMOs, as you could tell. Now, as for the government interdiction in healthcare, there is nothing, and I'm going to make a lot of people upset about this, there is absolutely nothing the government can do to bring down the cost of health care directly by legislating laws, as Obamacare did. What happened with Obamacare? Now, before I go any further, and I want to make some more people mad, I was asked a question, is do I believe health care is a right for everybody? No. You don't have a right to medical insurance. Okay? Sorry. Nowhere in the Constitution does it say life, liberty, and health care. I know life, liberty, and the pursuit of happiness is in the Declaration of Independence, but it's not the point. The point is nobody has a right to have health insurance, okay? Therefore, if you so desire not to participate, that's your problem, not mine. If you don't want to spend your money on it, then you don't have to. That's why we have a free society. That's why we have a society where you can spend your money the way you want. I disagree with requiring people to buy health insurance. Now, people say, well, you have to help cover the cost. No, that's socialism. All right, mandating that everybody pays in one amount of, if we're going to do something like that, we're going to develop a socialistic society. Then everybody is set down and taxed a certain amount of money every year that goes straight to health care, and all the health care bills go to the government. Now, in actuality, let me put it this way. The only way that we can bring down health care to participate like Canada and all these other countries that everybody likes to talk about does, the only way in the United States that the government can provide health care for everybody in such a reasonable price is the health industry, the health care industry is going to have to be owned by the government. That means every hospital, every dental office, every pharmaceutical company, every pharmacy, okay? Every aspect of the health insurance industry will have to come under the government control. All right? So then the government and all of the employees will be employees of the government. Now, we all should have enough common sense. I don't know about some people on this side of the aisle understands that the government cannot afford to own that. Okay? So now that we've got past that, let's understand this. All right. The reason why Obamacare increased premiums the way they did and the way they're going to continue to do is because when you, as an insurance company, or when you as a customer buy insurance, whether it's car insurance, homeowners insurance, health insurance, the more things that your insurance policy covers, the higher the premiums. Now, I don't think people understand how this works. They get it with their car insurance. They know if you buy just liability, your payments here. If you add collision or comprehensive, your payments go up. But why is that? Well, it's really simple. Liability insurance is for the person's car that you damage. If you get in an accident and you damage someone else's property, liability insurance will cover the cost of their repairs. Your cost of repairs is out of your pocket. If you add collision, then that means your insurance will cover your car as well. If you add comprehensive, that's everything not covered by the previous two, like hailstorms, tree branches, vandalism. Then the more you add to your policy, the higher the risk the insurance company is taking on. It's going to have to pay out on a claim. That's why the less stuff on your policy, the lower the premiums. Health insurance is the same way. When you buy a basic health insurance policy, then your premium is here. When you start adding stuff to that policy, you're increasing the risk on the insurance company of having to pay out on a claim. Therefore, they raise your prices. Okay? With Obamacare mandating every policy has to have alcohol rehab, drug rehab, prenatal care, all this other stuff that it required, what they did was they by law regulated how much risk the insurance company must take on. Therefore, the insurance companies raised their premiums. Okay? That's why policies went up. Now, if you also notice, to bring the prices back down, they increased the deductibles. Now, this is the problem. What I would like to see Actually, let me change that. Is what the problem is with the deductibles is the amount of money that you have to put out of your pocket. With your car insurance, if you got a $500 deductible, the way it works is the insurance company gets an estimate on fixing your car. Let's say it's $2,500. They subtract your $500 deductible. They give you a check for $2,000. You go get your car fixed. Now, if you get into an accident 6 months later, it's the same process. All right. With health insurance, the deductibles don't work that way. Your deductible starts over brand new every year, which means if you got a $5,000 deductible on your health insurance, then you have to pay the first $5,000 of your medical expenses for that calendar year. Then the insurance company will pick up 100% of the remaining balance for the whole year. But starting January, it starts all over again. All right. Now, first of all, you're paying $700, $800, $1,000, $1,200 a month for insurance. So let's just say we're paying $15,000 a year for insurance. Then you also have to pay the first $5,000 of all your medical expenses before the insurance even kicks in. So you're basically putting $20,000 a year out of your pocket to cover the cost of your own medical insurance, medical care. My question is, how many people, on average, has $20,000 worth of medical expenses a year? Okay? I know in the past 20 years, I haven't had nowhere near $20,000 worth of expenses in a total of 20 years. I don't ever have medical expenses. So I'm going to pay $1,000 a year for health insurance for something I don't use. Although it's good to have just in case. That's the purpose of insurance. This is one of the problems with health insurance is we used to have health insurance for the purposes that it's supposed to be, in case we got sick. Now we look at health insurance as a fact of, well, I got to have this to pay my medical bills. Because people go into the hospital for every little sniffle, runny nose, hangnail, scratch, boo-boo, and they got to have some way to pay for it. Okay? So, to bring down health insurance costs, we got to bring down the cost of health care. Okay? The health care cost is the biggest problem. If it didn't cost as much when you went to the hospital, the insurance ain't going to have to charge you as much for premiums. How do you do that? There's no government legislation that you can do that with. I'm sorry, there's not. Okay? Now, the biggest thing with Obamacare, I'm going to say this, there is one thing about Obamacare that I like, and that's the central exchange. I like the idea of having a central government website that any insurance company in the country can sign up on to offer health insurance to anybody. Now, what we got to do that is we got to eliminate the law that prohibits selling of insurance across state lines. So we get that knocked out. We need to do that. We'll get that done. Then companies from all over the country can sign up to offer health insurance. And what I want to see is insurance companies offer a basic policy. This is a basic policy. It's just for you. Now, if you want to add your wife, it's this much more. If you want to add 1 child, 2 child, 3 child, each child is a little bit more each month. Your wife is an extra $25 a month. Each child is $10 or $15 a month extra. You can tailor that plan to your needs. Okay? And then there's how much you want to spend on health insurance. That right there is the best way to do it. And what that does too, especially on the central exchange like that, what you have is multiple insurance companies offering you health insurance policies. And it increases competition. Competition reduces costs. Okay? I know this from 20 years in business. When I run paint and body shop companies. body shop stores, multiple stores. If I have a shop that comes in and offers the same product or a better product for less money, he's going to take my customers. They're going to leave me and they're going to go to him. So what I have to do is I have to increase my quality and lower my prices to compete with him to bring those people back to me. Because if I don't, I'm going out of business. That's the way capitalism works. That's where consumer-driven prices works in everything. Okay? The buyer determines the price. Because if he can get a better, as good or better product here for less money, he's not buying from you. And when you start losing business because of this, you change to bring those customers back. The central exchange will expedite that because it right there, insurance companies are competing side by side for customer business. Okay? The other thing that I think we need to do, and this is what I believe needs to be done to help bring down the cost of health care, is hospitals, the healthcare providers need to kind of go back a little bit to some of the old school way of doing things. Get rid of some of this contracting stuff and start hiring people on staff. You know, when I was a kid and we went to the hospital, when you left the hospital, you got one bill. Okay? The best I know, the doctors billed the hospital for his time. The hospital paid his bill and then they charged you. So you got one bill for the total amount of whatever it was that you got treated for at the hospital. And the other thing that I would like to see done in that aspect, though, is insurance companies going back to a percentage basis. Now, I'll get more to that here in just a minute. I believe that would also help with the insurance. But to bring down the cost of health care, right next to a railroad track is just awesome when they go by at freaking 2 o'clock in the morning. Anyway, what do I mean by bringing down the care of healthcare, cost of healthcare? A few years ago, it's probably been 7, 8, 9 years ago now, maybe even, I saw an independent study done about cost of healthcare in the United States, and what they did was they made up a fictitious patient, and they picked 10 different places around the country, 10 different cities, using this one fictitious patient with his medical background, and they got a price for a specific procedure that he needed. Same procedure, same patient, 10 different places around the country. And the price difference of that procedure, the lowest price was just over $1,500, and the highest price was just under $5,000. If that doesn't explain the problems with the healthcare system in this country, what does? Okay? Now, I understand that we do have to have, or we will have, a bit of disparity in pricing around the country. You have cost of living to consider, okay? When the health insurance, the healthcare industry, companies, hospitals, etc., start bringing stuff back in-house again, they're still going to have to pay their employees, and they got to pay them based off of cost of living where they are. Because, for example, cost of living in Adams County, Ohio is extremely low. Okay? So what you can get by on at $15 an hour in Adams County won't even cover your freaking gas in New York City or Los Angeles. Alright? So I understand that there's going to be a disparity, but what we need to do is come down with basically a national median price, and then allow a certain below and above that to compensate for cost of living. But $3,500 difference between the lowest and the highest is unacceptable. Now, the government can't dictate that because, and I want to explain why. Real simple. The healthcare industry is privately owned businesses. The government has no authority to tell a business how to operate. That's not the government's responsibility, but the consumers can. That's why a consumer driven pricing is the best way to lower prices. Now, back to the percentage basis on health insurance. I believe that instead of the annual deductible, like what we talked about earlier, why in fact if you don't spend $5,000 a year on your medical, what the heck's the purpose of having health insurance for? But what if you had a 80-20? Okay, now the health insurance companies can offer different percentages. The higher the percentage for the insurance, the higher your payment. The lower the percentage for your insurance, the lower the payment. It's just like your deductible on your car. When you have car insurance, if you have a $250 deductible, your payments are higher. If you have a $1,000 deductible, your payments are lower. Now, those of you watching, I want to tell you right now from my experience in the auto industry, if you have a $1,000 deductible on your car, change it. Change it to $500. It's not that much on the monthly rate. And I'm going to tell you right now, that $1,000 deductible, I've seen it firsthand. So many people coming in with a $1,000 deductible and couldn't get the car fixed because they didn't get enough money from the insurance company. Okay? And they don't have $1,000 to spend. Change it. Anyway, probably get some insurance companies mad at me about that one. But the point is this. If we went to a percentage, like my mom and dad's health insurance through the state was 80-20. The insurance company paid 80% of their medical expenses. Mom and dad covered the other 20, which was absolutely great. Okay, because mom and dad couldn't have afforded a $4,000 or $5,000 annual deductible. They couldn't have. All right, and so where the insurance company paid $80 out of every $100 that they were billed for, then the insurance then mom and dad had to cover the other 20, and that included every medical procedure. That included the whole medical bills. Now, of course, prescriptions were different, but and we got to work on that too. I hear a lot of people talk about opening up to prescriptions to competition from Canada and stuff like that. I'm going to be honest with you. I've never sat down and really researched that stuff, as in the quality from outside the country. I know due to FDA regulations, the quality control of drugs manufactured in the United States is extremely high. So the chances of receiving contaminated drugs is extremely low. Okay? What is the option for something like coming out of Canada or somewhere else? It may be tremendously cheaper, but are we going to exchange cost for increased deaths due to contaminated drugs? I have not researched that, so please don't take it, but I will. I get in office, I will research that, and if I believe it's safe enough, don't have a problem pushing for lower cost drugs. Okay? I personally dislike prescription drugs. I'm more of a natural remedy person, and I think that's something that we need to do, is start pushing medical facilities to do more research on natural remedies, plants, spices, herbs, things that are meant to be in our bodies. Prescription medicines are not supposed to be in our bodies. That's why they create so much of a problem. They're man-made synthetic chemicals that was never intended to be in your body, and your body shuts down and tries to get rid of it when you put it in there. Another thing that I think we can do is start researching causes of problems. For example, blood pressure. You go to the doctor, you got high, your blood pressure is high. The first thing the doctor wants to do is he wants to prescribe medicines to you. How about let's try to find out why you got high blood pressure first? And the answer goes, oh, just because you got high blood pressure doesn't work. There's a reason for it. Find a reason, fix the cause. You don't have to take medicines. there's a whole slew of stuff, and I ain't got time. I'd be here for a couple hours trying to cover all this stuff. I'm not trying to do that. But you understand the policies here. And those are the things we need to do with the insurance companies and the providers. Those will bring down the cost of health care. Okay? And those aren't all the answers. Like I said, there's many more. Now, eliminating Obamacare is going to create a big firestorm like it did last year. And the reason for that is because, yes, there were people that benefit from Obamacare. When Obamacare was enacted, it did help some people, but it hurt more than it helped. Okay? Removal of Obamacare is going to hurt some people, but it's going to help more than it hurts. You can't. There is no end all to be all. So you got to look at the balance. What is the best of the two? Some people would say the lesser of the two evils. Now, originally when Obamacare was implemented back in 2009, the Democrats pushed the fact that there's 30 million people in this country without health care. That's why we're doing this. Now, according to them, who slammed it through the Senate, put it on Obama's desk to sign, is that when fully implemented in 10 years, everybody will have health insurance. That's why we're doing it. Everybody has to be enrolled in health insurance. But then it came out that, well, once it's fully implemented in 10 years, there's still 30 million people going to be without health insurance. Is that some kind of this new math that I haven't ever learned of? If it's going to require 100% participation, but in 10 years there's still going to be 30 million people out of health insurance, the same number that's out of health insurance today it was passed, then why are we passing it? Sounds like it's nothing more than a way of increasing the cost of increasing government's budget, putting a lot of money in a lot of big businesses. And y'all Democrats like to say the Republicans are for big business. If Obamacare was funded the way it's written, you're talking about big businesses pocketing billions and billions of dollars. Okay? So, I don't want to hear that horse manure. Alright? But, the 30 million people that was without health care when this was passed, 2/3 of them were in an income bracket that they could afford health care. They were just the ones that chose not to buy it and participate. Only 1/3 of those people didn't have health insurance because they were either pre-existing conditions or low income and they couldn't afford it. After looking into it, it would cost the government less money if the government just paid 100% of the health insurance cost for those 10 million people than what Obamacare was going to cost the country. Okay? Now, that's not what I'm proposing. But what I am proposing is some kind of a system subsidized by the government working with the insurance providers to make sure those people have health insurance. What I mean by subsidized by the government, say, depending on your income bracket, we could set up a structured percentage basis. Everything from the government pays 20% of your insurance cost, you pay 80%. Now, I'm not talking about the health insurance bill. I'm talking about your health insurance premiums. All the way up to where the government pays 80% and you pay 20% of your health insurance cost. And that would be based off your income. Those who are of low income, and that would basically help those that are on pre-existing conditions. That would help them get their insurance in a manner that they could afford. The insurance companies would have to do some working to bring down the cost to help those people. And I think if the insurance company shackles was taken off from what Obamacare has put on them, where they could run their companies the way that they're supposed to, then I don't think they would have a problem with a few people helping, where this might be $1,000 a month policy normally, that it would be a $600-700 policy instead. And then the government works with them to help subsidize the cost of that. These are ideas that we need to sit down with the leaders of the health insurance industry and the health care industry and start working something out. And it's not a quick fix all problem, and it's not a quick problem it's going to fix in a matter of a month or two. It's going to take a while for all of the negotiations amongst all of the parties to come together on something that's going to be a benefit to 95% of the country. I'm not going to say 100% because there's always going to be somebody that's not going to get a benefit. There are too many people with too many different requirements and needs to say that you can get everybody covered. Okay? Part of the help on that would be the restructuring of what I plan on doing with the VA. Then, depending on which plan of action we use with the VA, we can probably help remove a considerable number of people out of the civilian healthcare industry in order to help the healthcare industry. All right. These are all things in this particular video that I cannot give definitive answers on because this is going to depend on negotiations. These are ideas. These are things that we need to sit down with the health insurance, the health industry, period, and we need to start working on getting it done. And that's what I want to do with the health insurance. Any questions, please feel free to ask. I'll answer the best I can. If you ask me something I got to look up, give me a day or two to look it up and get you an answer on, but I will always try to get back with you with an answer. Thank you.